What happens when you're in control of your finances, your career, and your well-being? There's no limit to what you can achieve. I'm your host, JaeVic, bringing you on a journey through finance, fitness, and finesse. A podcast about developing your 8 dimensions of wellness. If you're looking to elevate your wealth, well-being, and discover the power of balance, join me bi-weekly, Mondays and Fridays, to learn why money matters, but wellness counts. Hey finessers! Welcome back to Fitness Finesse Fridays, where we relate the intersection of your finances and your well-being. I'm JaeVic, your guide on this journey to elevate both your wealth and wellness. Today we're tackling a topic that we interact with daily, the impact of financial wellness on your physical health. If you're a listener of this show, I know you're working towards financial security, not just today, but throughout your life. I wonder what the world would look like if we reached a level of financial security that suited us. We all know the reality of the wealth and health gap. And what if I told you that low financial wellness can double your risk of poor health and make you 4 times more likely to develop a serious condition? Money stress isn't just an unpaid bill or a bad workday headache. It can actually take a serious toll on your body that we need to be mindful of. In this episode, we uncover how financial stress can lead to anxiety, depression, and even disease. Let's get into it. Debt and financial trouble are more than just a declined credit card or bank fees. They can significantly impact our physical health. Research shows that financial stress tends to be chronic. Chronic meaning it affects you long term. We all know what stress feels like for us as individuals, but did you know that according to Forbes, stress from financial challenges tends to be the most persistent? It definitely should not surprise you that financial issues top the list as the main source of stress for most people, outpacing major and especially current topics of politics, family, and work. Think about how those areas are heavily influenced by money, by our money. This brings me to mention the book of the episode, The Body Keeps Score. The Body Keeps Score is a book that helps us understand how trauma affects us. Dr. Vanderkolk reveals how trauma literally rearranges the brain's wiring, affecting areas dedicated to pleasure, engagement, control, and trust. When financial stress takes over, it doesn't just stay in our head, it shows up in our body. For example, people who have to deal with severe debt or financial instability may experience that chronic stress, leading to physical symptoms such as a weakened immune system, muscle tension, high blood pressure, headaches, and gastrointestinal issues. If this stress is persistent, it contributes to mental health problems like anxiety or depression, which, in a domino effect, can strain personal relationships. I'm sure you've seen family dynamics suffer as financial stress makes us more irritable, withdrawn, or just detached. Stress from those financial setbacks or stagnation can produce symptoms of severe fatigue, insomnia, along with that weakened immune system, which obviously makes us more susceptible to illnesses and disease. These kinds of health issues create a vicious cycle where financial stress triggers physical problems, thus leading to increased expenses, and the trickle effect continues from there. Have you ever experienced physical pain that constantly is on your mind and impacts your productivity and focus? In some jobs, how well you perform directly affects your paycheck, so dealing with physical limitations is a significant issue that many cannot afford to ignore. According to Forbes, individuals with high financial stress are twice as likely to report poor overall health and 4 times more likely to experience illness. Intergenerational poverty is a cycle that feeds on itself, creating an overflow of issues that compound one another. In situations where you may get to a point of needing to cut back on essentials like heating, food, or other necessities, mental health impacts can become severe. Researchers found that people in severe financial troubles are 3 times more likely to also think about suicide. As I go through a broad overview of how various factors impact our finances and physical health, I encourage you to listen closely for anything that resonates with your experiences. Financial stress is a major driver of chronic anxiety. As a student just graduating, trying to manage my income and expenses, I've been there. When you're always worried about bills, debt, or unexpected expenses, it keeps your stress hormone, cortisol, elevated. Many of us have turned to unhealthy coping mechanisms to escape these pressures at some point. Some people overeat, others may turn to substances, or get caught up in excessive media consumption, among other harmful behaviors. These actions not only provide temporary relief, but also contribute to the cycle of financial problems you're facing. The income and wealth gap shows wealthier individuals often have the advantage of disposable income, which allows them to access quality medical care, maintain healthier lifestyles, and better job benefits like health insurance and paid leave. This financial security allows them to afford regular health checkups, preventative treatment, a nutritious diet, and other resources that help sustain good physical health while lowering the risk of chronic conditions. And then on the flip side, those with lower incomes often face challenges in affording nutritious food, opportunities for that physical activity, and basic healthcare. Limited access to these resources is yet another contributor to the cycle of stress and impairment many of us are facing. The expense of medical treatments and managing chronic conditions can drain limited financial resources, and it's just not realistic for some people to pursue this part of their health. I will say, though, that even when wealthier individuals have more resources, they are not immune to the effects of neglecting their physical health. The grass ain't always greener, and if financially secure individuals choose to prioritize work and financial gain over their well-being, they most likely are going to face some long-term consequences, such as lower longevity, that's a shorter lifespan, and strained personal relationships. We should know by now that neglecting physical health can lead to chronic conditions that reduce that life expectancy and increase healthcare costs overall. The financial consequences of strained relationships, such as costly divorces or diminished family support, can hinder our ability to build a meaningful estate and legacy with those we love. I'm also wondering if you've ever heard of food deserts. Food deserts have severe food insecurity, meaning there isn't consistent access to enough nutrient-dense food. I'm sure that's hard for some of you to imagine when we have streets lined with restaurants, fast food chains, etc. But in these food deserts, many of them don't have supermarkets or grocery stores with fresh, affordable produce. Nutritious foods like fresh fruits, vegetables, lean proteins, and whole grains, among whatever else suits your diet, often cost more than processed, unhealthy options. Residents in these often low-income neighborhoods may find themselves relying on convenience stores or fast food places since that's all that's available in their area. And don't even get me started about the huge role transportation plays. Communities with lacking bus systems or residents without cars are not only restricted from accessing fresh produce, but also don't even have access to those higher-paying jobs that are in other cities that would thus enable them to afford different foods. Lack of nutritional food accessibility and job accessibility leads to serious health issues like obesity, heart disease, diabetes, among others. Managing these health problems can add financial stress, and families who are already struggling would rather focus on just keeping the lights on instead of taking the time and money to take care of their physical well-being. Where we live can directly impact our physical health. Financial instability may force people to live in inadequate housing. Issues like mold, pests, lousy heating or cooling, and structural problems can lead to respiratory issues, allergies, injuries, and more. I should also mention how overcrowded living conditions can contribute to the spread of infectious diseases. I understand that some families have to live with each other in small housing because that's all we can afford right now. But if you are forced to live in the same house as a bunch of your relatives, their kids, their mother-in-law, brother-in-law, all of the above, that's why it's even more important to try and keep good organization and good hygiene habits for everyone in the family. And it's also why it's even more important to be transparent about the financial situation. It takes a village, it takes a team effort to make a true change, not only in your physical well-being, but your financial and holistic well-being. Lean on your community to help you make an adjustment where you can. And here we find another cycle. Poor health makes financial problems worse, and financial strain makes it harder to address health issues. Access to healthcare is another critical factor that your financial health influences. People who can't afford healthcare coverage, prescriptions, or regular checkups, they are more likely to develop those chronic health problems we were talking about earlier, and they only become harder to treat over time. Low-income individuals might have limited access to primary care doctors, specialists, hospitals, and low accessibility impacts our health. We don't always have a choice as to what's accessible to us, but when it is there, take advantage of it. Ever heard of hospital deserts? These are regions where residents have limited or no access to hospitals and medical facilities. This means people have to travel long distances to receive basic medical care, which can be costly and time-consuming. In emergencies, the delay in receiving that treatment leads to worsened health outcomes or even fatalities. Without sufficient financial resources, many of us are unable to afford health insurance. Don't even get me started on social welfare programs. While they are designed to be a safety net for low-income Americans, changing government policies often create instability. This leaves many of us ineligible or unable to afford private insurance with adequate coverage. Check the show notes for an interesting article I found about the unwinding of Medicaid after the pandemic. Because when the pandemic hit, there was continuous coverage that was applied to help those in need during obviously a global crisis. But now that the pandemic is slowing down, policies are changing, so many are finding themselves suddenly ineligible for the Medicaid that they were relying on. Don't get me wrong, Medicaid is essential for many low-income Americans, but it comes with its downsides. Limited provider access, coverage gaps, variable quality of care, and bureaucratic challenges are common issues. There can also be inconsistencies in benefits from state to state, causing funding instability and managed care restrictions. The impact on providers further complicates the situation, making it even harder for individuals to receive consistent, quality care that's in need. I've seen these limitations make it really hard for private practice mental health professionals to accept Medicaid or different types of insurance. Since the pandemic, the demand for mental health support has exploded. Check the show notes if you're wondering why some therapists or residential inpatient treatment facilities don't accept certain insurance like Medicaid. Money worries cause people to delay or avoid medical and preventative care like vaccinations, checkups, or screenings. This self-neglect causes expensive emergency room visits that could have been avoided because minor health issues turn into major problems. Chronic conditions need regular care and medication, but these come at a high price, especially without that insurance. We still haven't figured out an adequate system to enable anyone to have the right to at least one primary care checkup a year. You would think that would put our tax dollars to good use, but I know a lot goes into the tax system, especially statewide and federally, to determine where it goes. It'd be nice if there was an annual and accurate report that was sent out to us of what our tax dollars are actually used for. But regardless, that's not our reality right now, and so in order to keep up with payments for these expensive medical visits, financially stressed people might skip doses or not follow their treatment plan, or go without necessary medical devices just because they can't afford it. I'll give you an example. Diabetics might ration insulin, and those with high blood pressure might not take their meds, leading to unavoidable complications just because they're trying to make their medication go further. When we can't afford the care we need, it results in worse health outcomes, higher emergency costs, and lower quality of life for generations in communities. It's also worth questioning how in a world where big pharma, the healthcare industry, and taxes are multi-billion-dollar giants, people in intergenerationally impoverished communities continue to suffer and die from treatable conditions just because of poor accessibility. The resources and advancements that we have seen in medicine don't line up with the reality faced by many who can't even afford basic health care. The last factor I'll touch on today is substance abuse. The pressure of managing financial difficulties often can lead us to seek temporary relief through smoking, excessive alcohol consumption, or drug use. These coping mechanisms bring severe health risks like addiction, liver disease, lung cancer, or other chronic conditions. Not to mention the financial toll of substance abuse, purchasing substances that you can't even afford in the first place, which then can include healthcare costs, lost productivity, and only adds another layer of strain. Over the last decade or so, we've also seen over-the-counter weight loss pills becoming a form of substance abuse, especially among adolescents and children. Weight loss pills might seem like a quick fix, but they can also become another form of substance abuse. When misused, like taking too many, mixing different types of weight loss products, or using them for way too long can lead to serious health problems such as heart disease, digestive problems, and even anxiety or depression. The fact that these weight loss drugs are so easily accessible, combined with that pressure to meet certain body standards, makes them especially tempting for younger people who might not fully understand the risks. Some people might even steal these pills because they can't afford them, which can lead to legal trouble and extra financial strain. Others who can buy them might even be overspending on these products, neglecting essentials like that nutritious food, healthcare, education, or exercise. Finessing our greatest wealth, our health, is not easy. If everyone had the resources and ability to maintain physical health, what would our world look like? Is this even possible with different health standards in different cultures? In America, hustle and diet culture tend to take priority. Imagine you're building your ideal lifestyle. Business is good, you have the house, the car, the boat, all the things you could ever want. But you've neglected your health in the pursuit of financial success. Now, you may be able to work less than before if your money is working for you, yet you're not able to even enjoy the fruits of your labor. Why? Because your body is in constant pain. Your family is gone because you didn't take the time to build those relationships. And these holes in your holistic health overtake your daily thoughts. No matter what your financial situation is, mindful movement is medicine. And if you're waiting for that motivation to go for a walk, go to the gym, or drink more water, let me encourage you that we need momentum, not motivation. Waiting around for motivation to strike will leave you more stationary than you were before. Get moving before your bones start fusing. As the great Gandhi said, it is health that is real wealth, and not pieces of gold and silver. Alright, finessers, that's all for today's episode of Health is Wealth. Key takeaway here is that true wealth is not just about financial success, but instead about balance between your health and your wealth. If anything, health is wealth because you can't truly be wealthy unless you take care of that physical part of you. It all ties together. We're working to choose what cycles we want to have in our life. Taking care of your physical well-being supports your ability to enjoy life, manage stress, and make sound financial decisions. Seek wealth through your health. If you found today's episode helpful, please share it with a friend or family member who could benefit from this knowledge. And don't forget to hit that subscribe button so you never miss an episode of Fitness Finesse Fridays. Got questions or topics you want to know more about? Hit me up on social media or drop a comment. Until next time, I'm JaeVic, and I'll see you on the Savvy Sunday Scholar. And if you don't know, now you know. Disclaimer, this podcast is for informational purposes only and does not constitute financial or mental health advice. If you or someone you know is struggling with thoughts of suicide or severe mental health issues, it's critical to seek professional help immediately. Resources and support are available, and I encourage you to check the show notes for information on how to get the help you need. Always seek guidance tailored to your needs.